So I think graduate school is competitive. Everyone knows that. Sometimes I think that intimidates students, perhaps unnecessarily. The first thing I would say is take a breath. Maybe don't necessarily believe all those numbers you see. It's not impossible. People do get in. So don't sell yourself out before you ever get started, number one. But then, obviously you're going to have to do well with your classes. Good grades are going to be important. Getting prepared for and doing well on the GRE is going to be important. Those are going to be, I think, necessary. You're going to have that to open the door. But I don't think that's going to make the case. That's not going to be what really seals the deal for you. And that's going to come really more from your experiences, particularly in the research area. Even if you want to go into clinical work, for graduate school, I think it's going to be more important to have research experience. So I really highly recommend to undergraduate students that they find some professors that they can talk to and get connected with a research lab. It does a couple of things. One is you learn a lot. So you find out what kind of research you might be interested in or might not. You learn a little bit about the process. Perhaps just as important or more important than that, though, is you get to know some graduate students, you get to know some faculty, so that faculty member can say more about you in a letter than just, well, I had this person in class and he did really well. They can talk about your responsibility, were you responsible? You followed through, did you solve problems? Did you think creatively? Did you help point out problems? How involved did you get? The more they can say about you, the more compelling the case is going to be to get you into graduate school. And then the graduate students, if you work with graduate students in a faculty member's lab, you'll learn a little bit about what their life is like, and that'll help you make some decisions, I think, as you consider what programs you might want to go to or how you might want to follow up with that. A lot of students say, well, should I get some clinical experience? And my thought on that is it never hurts. Any experience that's in the field is good, but what you can do clinically as an undergraduate is pretty limited. And so I'm not sure that that's going to really set you apart. If that's what you have and that's what you can do, it's certainly better than not doing it. But I don't think that will really be the thing that will set you apart. I think if you can get involved in research and really show some skill in that area, again, even if you are thinking you want to go clinically, I think that's something that can really help set you apart. So if you have the grades, you have the GREs, and you get that kind of experience. And then finally, I think the place where really good students make a mistake is when they apply, they say, here's all my credentials and I'm really good. And we read that and we agree with you. You are really good. What we don't know is, why do you want to come to our program? Who are you going to match up with in our program? What is it about our program that really makes a fit for you? And I think that's the place where a really good student can get lost in the shuffle, because there's no real clear connection between what you want to do and your skills and interests and what we have. So that's probably the most important piece of advice I think I would give to students, and I do give to students, is look through those programs thoroughly and see where the match is, and then really highlight that in your application materials so that the committees can see, oh yes, this is a person who's likely to do well in our program, they're going to be a good fit, they have the right interests, and so forth.
For that student, I would tell them to make sure that all of their psychology classes they've done well in, so they've got that good strong core, so GPA isn't something that negatively impacts them when they're applying for graduate school. And I would also say to get some research experience, whether that be with professors or graduate students in your university or nearby. I would also highly recommend a summer research training program where you get to more intensively get involved in research, so you know it's something you want to do or that you're interested in before you apply and enter a program that's 5 or 6 years long. So you want to really make sure you like what you're doing. Now, what I will say is, let's say you're really interested in cancer, but all you can find is cardiovascular summer research training programs. And that's okay in undergrad. You just need to get your feet wet in health psychology, show the ability to do research. You may not be working in the field that directly ends up being what you do later, but it's a really good fit. My summer research training was in tobacco cessation and social psychology. I'm doing health psychology. So it's just about showing that you have the ability, you have the skills, and you can go forward. So I would say do well with your classes, get some training and research experience, and also, even if you're thinking about clinical work, go get the research training, because there are not going to be as many clinical opportunities for an undergraduate as there would be research opportunities.
So the first piece of advice would be make sure you get out of that classroom. Be the pleasantly squeaking wheel that gets noticed, but also keeps on squeaking. So my little setup about having people contact me after a delay, after I put them off for a few months, is really a test to see if they'll keep it up and pursue. Certainly getting a PhD is going to take a lot of drive and perseverance, and so I want to see if they've got some of that up front. The other piece of it is, we know that the process of getting into graduate school is really 2 steps. You got to get interviewed, which is how you look on paper and your scores and your grades and your letters of rec and your experiences. And you have to interview well. And that piece troubles a lot of people. I see a large number of students who are overly anxious, don't have a good ability to see how they affect other people. They have some sort of interpersonal skill deficit a bit, more than just being a little nervous at meeting a professor for the first time. And I can kind of predict that they're going to struggle in an interview if they can't work on that. So I think that's another piece that they have to work on. And it's a tricky one. How does one know how you're perceived by others? You got to find somebody who's going to tell you the truth. And so that often requires people to start to have honest conversations with loved ones or other people who might, even a therapist or something, who might give them some honest feedback about what they need to work on in terms of their style. Students who work with me, undergraduates, I routinely not only teach them about research, but work on their professional style. Oftentimes it's building their assertiveness.
I think finding a good mentor is so important at the undergraduate level, and getting advice from that mentor is important. Coming to meetings such as the Society of Behavioral Medicine, American Psychosomatic Society, and Division 38 APA, really hooking up with psychologists in the field who could guide them as to what might be the optimal fit with their interests and what might be available as a training experience.